Marathon training is often portrayed as the ultimate test of human endurance. But what if those 26.2 miles are silently damaging your body in ways you never imagined? Could pushing your limits actually be pushing your heart towards failure? Why do seemingly healthy runners collapse during races? Is the famous runner's high masking dangerous physiological stress? How does marathon running accelerate joint degeneration? What hidden cardiac risks emerge after crossing the finish line? And most importantly, are we ignoring the long-term consequences of repetitive extreme endurance exercise? The human heart undergoes extraordinary stress during marathon running, with studies showing temporary damage to cardiac tissue in nearly half of participants. This trauma manifests as elevated cardiac enzymes and temporary swelling that can impair the heart's pumping efficiency for days, while most runners recover within days. Repeated marathon running can lead to cumulative heart muscle scarring that permanently alters the organ's structure and function. This fibrosis creates irregular electrical pathways that may trigger arrhythmias years later, sometimes presenting as sudden cardiac events during routine activities. The left ventricle particularly suffers from prolonged exercise, sometimes stretching beyond its capacity to rebound, which can lead to diastolic dysfunction where the heart struggles to fill properly between beats. These changes occur silently, with many athletes unaware until they experience palpitations, or worse during routine activities, highlighting the importance of cardiac screening for veteran marathoners. Joint cartilage absorbs forces equivalent to 3 times body weight with each running stride, creating microscopic fractures that accumulate over thousands of impacts during training. Marathon training's high mileage gradually erodes this protective cushion, especially in knees and hips where the cartilage is thinnest and bears the greatest load. Unlike acute injuries that prompt immediate rest, cartilage degeneration progresses invisibly over hundreds of miles, as the smooth articular surface becomes pitted and uneven, losing its ability to absorb shock effectively. By the time pain appears, significant damage often exists that may require surgical intervention or lifestyle modifications. Research indicates marathon runners develop arthritis nearly 2 decades earlier than non-runners, with many requiring joint replacements in their 50s, as their cartilage completely wears away. The impact compounds with each training cycle, making recovery between races crucial yet frequently neglected as runners chase faster times or more medals. The immune system suffers dramatic suppression post-marathon, creating a dangerous window of vulnerability, where pathogens can invade unchallenged. For 72 hours after crossing the finish line, runners experience lymphocyte counts comparable to chemotherapy patients, leaving them defenseless against viruses and bacteria. This immunosuppression explains why 50% of marathoners report illness within 2 weeks of racing, with upper respiratory infections being most common. Repeated cycles of intense training and racing may lead to chronic immune dysfunction, where the body remains in a slightly suppressed state, never fully recovering between events. Some studies suggest endurance athletes suffer more frequent infections than sedentary individuals, contradicting assumptions about exercise boosting immunity, particularly when exercise volume crosses certain thresholds. The combination of cortisol surges, metabolic stress, and nutritional deficits creates perfect conditions for immune system compromise. Dehydration and electrolyte imbalances during marathons strain kidneys to their functional limits, as they struggle to maintain homeostasis amidst extreme physiological demands. Many finishers show temporary kidney impairment markers similar to acute injury cases, including elevated creatinine levels and reduced filtration rates that indicate renal distress. While kidneys typically recover within 48 hours, recurrent marathon participation may cause cumulative damage to the delicate filtering structures called nephrons, reducing overall kidney function over time. Research tracking longtime marathoners reveals higher instances of chronic kidney disease compared to moderate exercisers, suggesting that the kidneys weren't designed for such repeated extreme stress. The combination of dehydration, muscle breakdown products, and anti-inflammatory medication creates perfect conditions for renal stress that can progress to permanent damage if recovery isn't prioritized between events. Mental health impacts often go unaddressed in marathon culture that celebrates perseverance over personal limits. The dopamine crash following race completion triggers depressive episodes in approximately 30% of first-time marathoners as their brain chemistry struggles to adjust to reduced endorphin production. This psychological letdown stems from both neurochemical fluctuations and loss of training structure that previously provided purpose and routine. to daily life more concerning are the behavioral changes observed in serial marathoners, with many developing exercise addiction patterns indistinguishable from substance dependencies, where they experience withdrawal symptoms when not training. The constant pursuit of longer distances and faster times masks underlying psychological distress for some participants who use running as their sole coping mechanism, creating a dangerous cycle where they run to feel normal rather than for health or enjoyment. Long-term vascular changes present perhaps the most surprising marathon risk that contradicts conventional wisdom about cardiovascular exercise. While moderate running improves circulation by making arteries more flexible, extreme endurance exercise correlates with increased arterial stiffness and calcification that can actually impair blood flow. Autopsies on veteran marathoners reveal higher plaque buildup than age-matched controls, suggesting the inflammatory effects of prolonged intense exercise may outweigh its cardiovascular benefits by creating microtes in artery walls where plaque accumulates. This paradox reminds us that more exercise isn't always better, and that 26.2 miles demands respect as both an achievement and a physiological trespass that pushes multiple systems beyond their evolutionary design parameters. If this exploration of marathon risks made you reconsider your training approach, subscribe for more evidence-based fitness insights. Make sure to hit that subscribe button, give this video a thumbs up, and share it with your friends and family. Thanks a bunch.